Well, hello, friends. In this episode, I'm going to suggest you buckle your seatbelt, you turn up the volume a little bit, and whatever you're doing, if you're multitasking, stay with us. You're going to learn the very two things, specifically from the doctor's mouth, that you want to avoid if you want to age optimally and specifically reduce your risk of heart disease. You're also going to learn the 4 tests of heart health and or your heart disease risk, and you'll be surprised. I encourage you right now to think about what would you say those were. And I'd be willing to bet that one of the things you're going to put at the top of that list is not on the list at all. I'm going to leave you sitting with that thought. I'm Deborah Atkinson. You're listening to Flipping 50, where I address your top struggles and concerns, but most of all, I hope to inspire you to age optimally and be stronger and fitter, maybe even faster as you age, as opposed to older, sicker, and fatter. I share with you what to eat, how to move, and how to change your mindset, often about what to eat and how to move, so that you can absolutely have the energy and vitality that you want, need, and deserve in this second and better half. We're going to dive in. I can't wait to introduce you to my guest. And before we do that, just want to let you know this show is sponsored by my monthly Masterclass. We meet the second Wednesday of every month. So the date rotates, but I'm always here. That is open to the public, though some of our master classes are exclusively designed for our membership, and we deep dive into those. You too can have the opportunity to ask me questions at the end of our monthly open to the public masterminds and sit and be privy to specific content based on the most frequently asked questions that I've gotten in 37 years about menopause and postmenopause and fitness. And I will share with you those questions that are most frequently asked, but also give you the insights on what does research say about it. No one's opinion, but literally what are the facts so that you can make informed decisions. Topics usually include what's the truth about strength training after 50? What's true about those signs and symptoms of menopause and what you can do about them, how much your lifestyle impacts them. We've talked about libido health, about bone density building, about how much protein you really need, and oh so much more. So join us here monthly. The best and easiest way to get the notice so that you know when those master classes are and you can register before it's too late is to join me at flipping50.com. On the homepage, you'll see how to join and get involved. If you've never been there, now's the time. Second, if you're listening and it's May of 2021, I have a very special 10-day challenge coming up. We start June 1st, but the sooner you get registered for this 10-day Hot Not Bothered challenge, where I'm going to support you and let you know all the inside intel on exercising specifically for hormone balancing and optimizing. Now, don't take this wrong. I can't help you create estrogen if your estrogen is already on decline. But what I can do is help you optimize the dozen or more hormones that influence and are influenced by exercise when you're a female going through midlife. There's very little research out there, less than 10%, on you, featuring subjects that are women in menopause. But that little sliver is 100% of the research that I use, together with 37 years experience working full-time in the fitness industry. So with that, we share that content. When I'm going to give you the exercises that you'll do 10 days in a row, I'm also going to whisper in your ear with an audio every day about why this exercise is planned for today, how it complements what we did yesterday or you'll do tomorrow, and what it does for your hormones. So that you know the how and the why, you'll be much more motivated to do the what correctly. So if you're in, you want to head on over to flipping50.com/podcast and click on today's episode. So don't miss it. And are you ready? We're going to get started. My guest today is Dr. Stephen Masley. He's no stranger to Flipping 50, and he is a physician, nutritionist, trained chef, and creator of one of the top health programs on PBS, 30 Days to a Younger Heart. He's a fellow of the American Heart Association and the American College of Nutrition and a clinical associate professor at the University of South Florida. His latest best-selling book is the new and revised The 30-Day Heart TuneUp, with a plan to help prevent and reverse heart disease. His work has been seen by millions on PBS, the Discovery Channel, the Today Show, and many other outlets. For details, you can visit his website at drmasley.com. That's drmasley.com. We'll say that again at the end of the show. Welcome, Dr. Masley. How are you?
Delighted to be with you.
Well, me too. Although I'm going to dive right into the nitty gritty here. I mean, I've been in fitness, talking about exercise physiology and kinesiology. This is 37 years this year. Why is cardiovascular disease still the number one killer of men and women?
Well, it shouldn't be. I mean, I hear your point there. It's kind of erotic. Why is it still?
Yeah.
Because we know we can prevent 90% of heart disease, but we're clearly not doing it. So the big problems are one, the medical system. We spend 90% of all our resources treating heart disease with procedures and hospital care, end stage treatments that don't really extend people's lives. And two, we practitioners, oftentimes we provide conflicting information with things that are really hard to follow sometimes, and not very many people are able to keep up. So I think, we need to put more emphasis on prevention, and we need to have a more consistent, easy to follow message if we really want to make a difference.
Okay, which brings me to this. So obviously, you are all for being proactive, and the name of your best-selling book, your most recent one, The 30-Day Heart Tune-Up. So let's talk about that, because everybody in my audience loves a 7-day, 14-day, 30-day something. So can listeners really see results in 30 days? Is that possible?
Absolutely. I mean, we know, I've been following people for well over a decade, 20 years with this program where I've offered people. And we know within a week or two, people have more energy, they sleep better, their sex lives get better. And by a month, I mean, I'm oftentimes having to stop people's medications because, stop their blood pressure med or their cholesterol med or something like that. And so, yes, people feel dramatically different, and we can see that in their lab markers. And by a year, we've helped hundreds of patients shrink their plaque by more than 10%. So they're shrinking the cause of heart disease, that plaque that grows in their arteries. So really, short term and long term, you really see amazing changes.
Okay, so the audience, the listeners are going to love that quick change, but they're also potentially going to be thinking, okay, but we want it to be easy. So fast is great, but are we talking turning their life upside down? Are we talking small tweaks?
No,
Give
no,
us
what we're really
some
talking
hints.
about is, I mean, more of a focusing on food and a Mediterranean diet. I mean, there's 5 pillars to this. There's, as you would appreciate, there's an activity component. Importantly is the food component, and you have to meet your nutrients, and you have to manage your stress. I mean, all those things are important, but food, I think, is food and activity are like so important. And the food part is the easiest part, which for most programs, they make it the hardest. So in this case, I'm really thrilled to be 100% behind a Mediterranean diet that allows people to eat delicious food that's easy to prepare. They can follow it long term. It's not only the U.S. News and World Report ranked it the number one healthiest diet, the best heart diet, and the easiest diet to follow. I mean, I think easiest to follow is really important. And that's what I'm really after is something that's easy to do long term and sustain and still eat delicious food because I like food.
Yeah. And I think our listeners will probably jump on that bandwagon too. So, back to something you said. So, what are the top nutrients to support the heart? And what is it about the Mediterranean diet that makes it so good?
Well, top nutrients. Um, so in our clinic, we analyzed plaque growth in over 1,000 patients and looked at is their plaque growing, shrinking, or staying the same over time. And what we realized when we first meet someone, there's certain nutrients that are super important to determine the age of their arteries when we meet them. And if they have excess plaque and they want to shrink it, adding those same nutrients are critical if you want to shrink it, along with the other parts we discussed. But those are magnesium, fish oil, vitamin K, zinc. These are just and fiber, especially vegetable, fruit, beans, and nuts for fiber. But those are really the top nutrients that are so important. And the newest nutrient I would throw in there that's come up in really recent research and really led me to write the revision for this book is the importance of probiotics and how much probiotics impact the benefit of your heart. So those are the top nutrients.
Fantastic. Okay, so I want to stay on that vein of nutrients. And I have my finger up to remind myself of this because as you were talking about, and boost your libido, everyone in my audience, I mean, by far in the last couple of years, different master classes that I've had and talk about libido as it's related to exercise, how it could
Yes.
be hurting and helping. Those are very well attended. I have audience members who will say, my husband is so excited about me going to this. So, what are
Okay.
the
I
top
get
nutrients
yes.
that improve sexual? Yeah. What are the top nutrients that improve sexual function and libido? If they're the same or different, can you share that?
Well, I'll come to that, but let me say something first, if I may.
Yeah.
And that is that the nutrients, I mean, the things that are good for your heart are really good for your sex life. Because what your heart is all about is circulation. If you have better circulation, you have better sexual function. For men, that's erectile function. For women, that's lubrication and sensation. So, circulation is an essential part for both genders, how we function. But the good news is not only is the right food that's good for your heart good for your sex life, but at the same time, sex is really good for your heart. You get all sorts of benefits from being romantically, sexually active that really make. So I just wanted to point that out before we talked about sexual nutrients, just the whole click there that I think is so important. If now to come to your real question, which nutrients are they? They're like arginine. Arginine we can like from beet extract. It makes nitric oxide. And zinc for adrenal function and energy, and tyrosine for sexual pleasure. So really good sources of those foods would be like shrimp, lobster, game meats, uh, oysters, the things that we would, caviar, shrimp, seaweed, salmon. Those are really food sources that provide those top nutrients that are sexual, that help us with sexuality.
Okay, fantastic. So it's not a myth about oysters. Love that. Okay. So let's kind of dig a little broader maybe, and I think we're very pro-aging here. And not necessarily are we anti-aging. We know we're not going to actually win that battle, but we
Yeah,
want to age the best possible and love
right.
every age. And that I think is something we can win. So when I ask this question, it'll sound a little bit uh, fake or false, but turning back the clock is the words I'll use. I mean, what would you say as a physician who's studied the heart, obviously well versed in libido? My audience loves you already. Um, I mean, what's the first thing listeners can do to turn back the clock on
Well,
aging?
turning back the clock. So, and I agree with you. I'm not anti-aging. I welcome aging.
Mm,
I think we
yeah.
get better with time in many ways, like red wine. And so, aging has some benefits to the quality of our personality and our lives. I'm probably a lot easier to talk to now than I was as a teenager, and I wouldn't want to go back. So, I distracted myself there with that long-winded answer. But when I think about turning back the clock, I think the first step is really the right fuel. And as you get the right fuel, you have more energy, and then you're actively able to be more energized, and you want to do more, and you want to be more active, and you want to get stronger and have a better libido. All that kind of comes. I think I think the starting place for that is fuel. And fuel leads to activity, and then when you have more energy, you can take proactive management steps to manage your stress. It all comes to and meet your nutrient needs. It all comes together. But I think the first step to turning back the clock to be not so much younger in age, but physiologically younger. I mean, we've looked at age markers in my clinic, and I would say our average patient over time who follows the program becomes 10 years younger. I I actually did a discovery program, back 20 years ago with Discovery, the show, and we did a 10 years younger show, and we actually showed that you could make people physiologically younger by having them eat the right food, meet their nutrient needs, add the right activity, and manage their stress. That if they did those things right, you really could turn back the clock. We're still going to age, but we could be more energized and active and feel better even as we get older.
Love that. Out of curiosity, just there's going to be a listener who's thinking, can I still see that show? Is there a way for them to search that?
Oh, wow. Yeah. 10 years younger on the Discovery Channel. There's probably, I mean, you could Google it. I haven't
Okay.
tried, but
Of course. Of course. That's the
that was
answer,
back when
everybody.
I lived in
Google
Miami. That was
it.
that was back around 2000, so literally 20 years ago.
Wow. Okay. All right. So proactive things, yes, you can do. What about if we flip this? What are the, say, top two? You can expand if you want to. Top two things people should avoid who want to age optimally.
Well, sugar and flour, food-wise.
Wow.
I mean,
You didn't even
sugar,
hesitate.
well, it's just the number one cause for heart disease is elevated blood sugar levels. It's not cholesterol, it's elevated blood sugar levels leading to insulin resistance. That's the number one cause for heart disease. It's the number one cause for memory loss and Alzheimer's disease. It's the number one cause for diabetes. It's probably the number one cause for weight gain. And it might even be the number one cause for cancer, at least right up there with smoking. So, sugar and flour are really bad for us. And I say flour because if you were to eat a bowl of white flour or whole grain flour or a bowl of sugar, you have the same sugar response. And I think a lot of people don't realize that sugar and flour biochemically are the same thing when we consume them.
Okay, so I've got a doctor here with me, so I've got to ask you this and go down this path. Let's talk sugar. What qualifies? So we're talking white table sugar, but what about honey and molasses?
Honey, yeah, honey
People will ask
qualifies.
all,
Maple syrup qualifies. I mean, honey is
okay,
probably like what,
yep,
98% sugar and
yep,
2% nutrients. And it actually has a little bit of probiotic in it. So if I was going to have sugar, I would have honey
hmm
in a recipe.
okay,
But let's be real, physiologically, it behaves 97, 98% just like eating table sugar. It
okay.
does have additional benefits on the side.
What about fruit? And I say it like this: eating fruit naked. like in the middle of the afternoon when you may have a little low
I
blood
don't have
sugar,
any,
or
I think
first
it's a
thing in the
great
morning
snack.
eating
I'm not
fruit?
concerned. Here's the thing about
Okay.
fruit.
Okay.
Fruit, when you eat whole fruit, we're not talking fruit juice and we're not talking dried fruit. When you eat whole fruit, it's
Right.
got fiber, and the fiber blunts the blood sugar rise you get from it. So all fruit except for maybe a ripe banana, all fruit, pineapples, apples, grapes, they all have a low glycemic load. They all have a low sugar load, all of them. In a
And
normal 1 cup, portion, an apple, an orange, a cup of berries, all of them have a low sugar load if that's what you, and you can eat them by themselves or you could eat them with it. If you ate them with nuts, which have some fat in them, that even have less sugar impact on your bloodstream. But as it is, it's low.
if you and I were talking about, okay, fruit versus vegetables, would you suggest one over the other?
Well, vegetables have a lower glycemic load. They have a lower glycemic load, but they both have benefit. And if you actually look at blood pressure response, there's been more benefit from eating fruit from eating vegetables. If you're looking at cancer prevention, you're probably better off with vegetables. So it depends on, I look at both. I'd like people to eat a minimum of 5 cups of vegetables and fruits every day. I usually try to say vegetable fruit first because they have a lower glycemic load. And I'd like you to eat 3 cups of vegetables and 2 pieces of fruit or 2 cups of fruit a day. That to me would be the minimum intake that I'd like everyone to get.
Nice. Love it. Okay. So we've got people here thinking about their heart. They're probably distracted thinking about their libido as a benefit. But if you did 4 tests to assess for heart disease risk, what would they be?
Well, cholesterol wouldn't make the top 4. I'll just say that up front.
People are surprised. Wow.
Yeah, it wouldn't make it. So, especially for women. So, cholesterol, like let's look at, I'll answer this backwards. Why isn't cholesterol in there? Well, especially for women, statin meds have really never been shown to be very effective for women. They are effective for men with really advanced heart disease, but it doesn't mean an individual woman might benefit. But if you do a study on 1,000 women versus placebo with a statin med, you may not see a lot of benefit because cholesterol is not the number one cause for heart disease, especially in women. So, what would be the top 4? I'd probably put sugar as first.
Hmm.
That'd be most important. So I'd measure it. I'd do a fasting blood sugar level. And if your level was elevated, I might even want to look at your fasting insulin. But fasting glucose would be first. Second, might be nutrient intake. I'd want to see your nutrient intake right up there, or I'd measure your blood pressure because blood pressure is a measure of function of your arteries. It's not just a risk factor. It tells me how your arteries are functioning. If your blood pressure is elevated, I know your blood vessels are constricted and you're growing plaque. And if your blood pressure looks great, like 108 over 70, then your arteries are relaxed and dilated. I know how they're functioning. So blood pressure and sugar are really important. I'd look at nutrient intake and I'd look at fitness. The data from our clinic showed when we measured artery plaque in all these patients and looked at, is it shrinking, growing, how old are their arteries? Fitness was in the top 2 or 3 predictors all the time, consistently. And it doesn't matter how many minutes you exercise, it matters how fit you are. So you want to be aerobically fit and you want to be strong. You need that mixture of like burst interval training and strength training to get the most out of your fitness program, which I'm sure is music to your ears.
Oh, I was just about to say, thank you, God, amen. Okay, our work here is done today. No, but I love that. And I want to call listeners' attention to something you said. So it's not about minutes, and it's been conditioned for years and years that you should get X amount of minutes. And we keep giving this out. Position
Yeah.
statements keep driving that in, but it's what the time you spend does to your fitness level. It's quality, people.
Yeah.
And
So
so
I would
you're,
measure fitness. I like
yeah,
measuring it. I like running people on a treadmill. And I like measuring their strength.
yeah, love that. So awesome. So thanks for capping that. That's awesome. Okay, so did we hit 4 tests? We got them all?
Yeah.
Okay.
If I was just going to do four, I would do blood sugar,
Yep.
blood pressure,
Hmm.
nutrient intake, like the
Yep.
key nutrients I mentioned
Hmm.
in
Yep.
particular, and fitness.
Missed.
If I got a
Sweet.
couple more, I'd probably do high sensitive CRP,
Hmm.
especially for women, because I think inflammation is a bigger risk factor than is cholesterol for women for heart disease. And the one thing that would top all of them, if you could get one thing at least once, if you were only going to do a test once, I'd want them to know their carotid IMT, which is an ultrasound, 10-minute test, no radiation, not horribly expensive way to measure how much plaque is in your arteries, how old are your arteries. So you could get it because that's the most important predictor of risk. It's not the cholesterol or the blood sugar or the blood pressure. What really matters is, are you growing plaque? So if there was a one-time measure they were going to get one time, I would say, because you want to assess your risk, I would say measure that.
Great recommendation. My brother and sister-in-law were just here for 5 days, so this is a message that's going straight out to my brother, so he needs to hear this. But I want to ask you, you said it's not a terribly expensive test. Is it a test that if you asked your physician would be covered by insurance?
Probably not,
Okay,
because you're measuring the age of your artery. So it's a measure of aging.
got it.
It's not a disease marker. Now, if you have artery disease established, they might cover it. But I think that's just stupid. The best test
Yeah,
we've got, we're not going to order it unless you're already near
right.
death.
Yep,
Why would, but that's how our system is. Remember in the very beginning, we
totally.
said we spend 90% of our resources on end stage procedures that aren't very effective in improving the quality or the length of life. There's treating symptoms at the time.
Yep.
So
Okay.
it shouldn't be too much. Yeah, our whole healthcare system in many ways is backward, and this is a good example of that. That we cover a procedure, an elective procedure for someone that costs 20, 30,000, $40,000 that may not have any long-term benefit. But we won't cover them to go to a fitness guru trainer. We don't cover them to see a nutritionist, and we don't measure their plaque to see how much they've got. I mean, to me, it's crazy. But that's the world in
That
which we
is
live.
crazy. You know what I'd love to do? I want to ask another question because we're kind of talking about your new book, and I want to talk a little bit about your background with listeners. But before we get there, I would love, so I know you and Nicole are very active. I'd love to know what's your typical workout routine? I mean, what does a workout week look like for you?
Okay. So, well, yesterday I did strength training with some weights and pushed myself, and I did a yoga session. And this morning I got up early and I went for a 20-mile bike ride and did it hard. So some mixture. So to me, that's really what I like. So I try to do a bike ride, say intensely 4 days a week. I go out on the paddleboard twice a week intensely for a little mix and get some more core strengthening thrown in. And then I like to work out with weights at least 2 to 3 times a week. And then I try to throw in yoga every other day.
Nice. What type of yoga are you doing?
I go on YouTube and I pick who's teaching a yoga
Stop it.
class.
I'm gonna have to edit that out. Okay.
Sorry, you
I'm kid-
can,
I'm
but that's my
kidding you.
honest answer.
I'm kidding you. So is it a gentle, relaxing? You choose
No, no,
power?
it's
You vary
it's
it.
it's there's lunges and warrior poses, and
Okay.
it's a half stretching and half strength training, I would say.
Got it. Okay. Great. Oh, thanks for sharing that. Okay. So
Yeah, yoga
you're,
is a nice way. If
yeah,
you do the right types of yoga, can throw in some nice strength training to go with it. It's a
for sure.
complements. a
Yeah.
mixture of strength training and stretching at the same time.
Yeah, a little bit more focus, I would say, on muscle endurance than what you might be doing in reaching fatigue when you're
Yes,
doing strength training with
absolutely.
weights. Yeah, great
Yes.
balance. Yeah. Okay, well, I want to dive back into your background because it is so interesting and varied. I mean, how many times have I ever, zero, introduced a physician, nutritionist, trained chef? Never. So,
It's pretty it's pretty unusual. I don't think I've never met someone like me.
well, you're one of a kind, doctor. So, I would love to hear a little bit more. So, I know enough to be dangerous. You did a chef internship at the Four Seasons in Seattle. Am I correct?
Yes. Yep, you are.
Okay. And so tell us a little bit about kind of that and your evolution to developing the recipes that are in this program.
So I was already a physician working in a clinic, busy practice, and I started doing research trials trying to incorporate functional medicine. This is back in the 1990s. So in the 1990s, I was trying to incorporate functional medicine into a traditional medical practice. And
Wow.
I was one of the first physicians in the country to offer, one of the first two to offer group visits. So I would take people who had heart disease or diabetes or menopause or some combined group topic. And I would meet and we would talk about lifestyle alternatives to treat that. So we would be less reliant on drugs and bad outcomes. And what the people in the group told me was they needed less information on grams of fat and grams of fiber and more recipes that were delicious, easy to prepare, and they could find the ingredients in their local grocery store. And I heard that message so many times, I finally said to Nicole, my wife, like, okay, this is it. I'm going to have to go back to cooking. I had done some cooking catering in college. I would cater events. So I at least knew enough, I liked how you said it, I knew enough to be dangerous. So I could manage myself. And I'd already actually written a health book with recipes in it. And I applied to work at a restaurant for a summer. I took 6 weeks of sabbatical leave to work in a restaurant. And from there, they said, you should apply for a chef internship. And so I did. I applied at the Four Seasons in Seattle. I took my recipe book. I told them they didn't have to pay me. I didn't pay very much to an intern. And I spent a year working every other weekend and 3 evenings a week at the Four Seasons. It was amazing. I learned so much. And I realized you could make healthy food taste great. That was the whole point. You can make healthy food taste great.
Yeah, I love that. And I love how it also doesn't have to take that much time. It's not that difficult. So important to all of our listeners.
Well, especially Mediterranean dishes. I will say my initial recipes were harder to follow than they are now. So, what I've realized over time is if you get local, fresh ingredients that are good quality, your food's going to taste fabulous. And that's what Mediterranean cooking is all about. In season, local ingredients, good quality. Don't make it complicated. Don't make it hard to make. Don't add too many ingredients. Simplify it, and you get fantastic, delicious food.
Love it. I think everybody listening is on board with that. Okay, so I know that the 30-day Heart TuneUp is available everywhere that books are sold. It's already out. Where can listeners, though, get more Dr. Masley? Best place?
My
Social?
website, I have a blog.
Okay,
I send out recipes and health tips every month. So,
sweet.
um,
Oh, so you're
so
sharing all those great
yeah, so
recipes.
they can go to drmasley.com, drmasley.com, and sign up and get a free gift to sign up to join that list. It's free. They can drop out and unsubscribe at any time.
But why would we want to, right? Does any woman listening have too many recipes ever? Right? So I love it. Is there any more question? Is there any more questions that I should have asked you while I've got you?
Well, if I think the biggest challenge here is that people are waiting for something bad to happen to take action.
Mm,
And when it comes to heart disease, that's a really bad choice because the first symptom of heart disease oftentimes is either death, a heart attack, or stroke. That's the first symptom. So, when to take action is now. Don't wait. Who doesn't want to feel better, have more energy, have a better sex life, have better cognitive function, and prevent heart disease? So I would say get going. When to start? Now. Don't delay. Don't wait. Normally, our normal tendency is to perseverate until something bad happens. But that's a terrible concept when it comes to heart disease.
thank you so much for sharing. That it's been gold nuggets all the way through. Thank you so much. Listeners, now I know you may have a question that I didn't ask. And of course, we've got the link on the show notes. That'll be at flipping50.com/heart TuneUp is where you'll find that. All the links that we mentioned in the show notes, links to social media to connect with Dr. Masley as well. And you'll get all the juicy notes and the questions that we've asked in the time links so that you can get right to them, because we drop so many great things about nutrients for heart health, nutrients for libido. I know you're hanging on the edge of your seat on that one. But if you have a question, you can leave that below the show notes at flipping50.com/heart TuneUp. And what are you waiting for? Let's start flipping 50 today.